Today we're going to share some of the findings from the YRBS survey that was released recently in the state of Maryland. So first, this is our attribution page. We legally have to have this. Now I'm going to explain what YRBS is. So YRBS stands for the Youth Risk Behavior Survey. It's a statewide survey that's conducted in Maryland of students in middle and high schools. It's conducted every 2 years in even years. So the most recent one was supposed to be conducted in 2020. It's been conducted in 2021 instead for obvious reasons, and that data has now come out. It primarily, I would say, focuses on tobacco use among youth and other health-related behaviors. It also asks questions about drug use, nutrition, alcohol consumption, sexual health, and kind of a variety of other topics. So how it works is that the survey randomly samples Maryland middle and high school schools. And within those schools, random classrooms are also selected, and the students in those classrooms are asked to fill out this survey. And the purpose of this random sampling is to try to ensure an accurate representation of the general population. And this is kind of a theme that I'll be going back to as we actually wade into the data. This is what a page of the survey summary tables actually looks like. So you can see that you have the total number, the total percentage of kids who answered yes on a particular question, and then you have that broken down by age group, by grade, by race and ethnicity. And you have all those same categories broken down again for males and for females. So this is kind of the depth of information that we can pull from. You know, we can look at a particular grade or particular gender in that grade or race. Today, we're just going to be focusing on gender and race. And by race, I just mean Blacks, Hispanics, and whites. Unfortunately, a lot of the other races like Native American and multiple just had too small numbers to provide meaningful data, and the Asian category was not asked in every year. So this first part of the presentation will go over the significant trends in Howard County high schoolers. So this will just be looking at what changed from 2013 to 2021. And then after that, I'll be talking about some other ways that we can use and analyze this data. A trend was considered significant when the confidence interval of the indicator in 2021 excluded the confidence interval of the indicator in 2013. And visually, you'll see what I mean as soon as I pull up a chart. But I just will say for now that a confidence interval is the margin where we think the real number is, because the survey asks about 1,000 kids in Howard County, and they weigh the survey among different races and ages and genders to try to maintain as accurate a sample of all Howard County high schoolers as possible. But of course, no survey is perfect. So the confidence interval is just where we think that the real number might be based on the survey number. And statistical significance is not the same as just visually being able to see if a line is going up or down. I think of it as kind of similar to being on a jury. You have to be sure beyond a reasonable doubt. You might be on a jury and think, yeah, I get a bad vibe off this dude. I feel like he did it, but that's not, you know, enough to convict. And it's kind of similar for statistical significance. One thing that we should keep in mind when we're looking at the 2021 data is that a lot of the questions ask about the behavior going back 3 months or 12 months. So the 2021 metrics might well cover the pandemic lockdown, which obviously had a lot of implications for youth risk behaviors. And where a trend was significant from before the pandemic, I will be noting that. And lastly, I think it's just important to say this: correlation doesn't equal causation. Sometimes the obvious the obvious causal mechanism is in fact the right causal mechanism, but sometimes it's not. So always important to keep an open mind. Okay. We'll jump into trends just right away. So we'll start with the trends on youth sexual behavior. So the broad takeaway is that fewer students have ever had sex or are currently sexually active. And this decline is primarily driven by males. So even though right now in 2021, about the same percentage of males and females reported that they were sexually active, males just started from a higher baseline in 2013. That decline has been much sharper for male high school students. And we can also break it down by race and see that a lot of this decrease is among Black and Hispanic students. The kind of flip side of that is that much fewer students are sexually active and currently having sex, but a greater proportion of those students are foregoing condoms or birth control, which is obviously not a great sign. Also not a great sign, so male students who date have been increasingly reporting that they have been physically hurt on purpose by someone they are dating. Obviously, dating violence is a very bad indicator in our youth. So looking into it further, it looks like female students who date have also been seeing a non-significant increase in 2021, and we'll be diving into that more. It's a little harder to tell because fewer students overall are dating. Our mental health trends are some of the clearest and most concerning trends that we see in the YRBS data. We know that nationwide, depression and suicidality has gone up among youth, and Howard County is no exception here. It appears that pre-existing trends towards depression and suicidality have continued and even accelerated in 2021 after the pandemic. This is true for both male and female students. They're reporting greater depression. Female students, though, are reporting both depression and suicidality at higher rates than male students, and they're experiencing a sharper increase than male students. All races have been reporting increased depression. In terms of trends and suicidality, we see a sharp increase among Black and white students. This is not, unfortunately, good news for Hispanic students because we haven't seen a trend there because they've consistently reported high suicidality throughout the years. For nutrition, fewer students are drinking soda, fewer students are also eating breakfast. I don't know if you've heard the one about Gen Z being serial killers, but it's true. That will be the only joke in this presentation. I hope you enjoyed it. More students have been reporting obesity, particularly among female students and Hispanic students. And there's a lot of different questions asking about fruit and vegetable consumption with varying levels of granularity. But the takeaway is that across a few metrics, it looks like there's a general decline in fruit and vegetable consumption. Drug use, fewer students are using marijuana, ecstasy, or were offered drugs on school property. That last one, that's one where it seems like it might have something to do with the pandemic lockdown, right? And this decline in drug use is primarily driven by male students. We also do ask questions about cocaine and other drugs. There's just not a trend to report there. It's fairly low. Alcohol. This is another clear trend in the downward direction. Fewer students are drinking alcohol. It's been declining across all races and all genders, and particularly among Black students. Black high schoolers were generally the race least likely to be drinking in the first place, and they've also seen the sharpest decline. one thing that is concerning about this general trend is that while male students are becoming less likely over time to either ride in a car that's been driven by someone who's been drinking or drive themselves when they've been drinking, which is what we want to see, uh, female students, that downward trend is showing signs of actually reversing. So we'll get to those slides as well. Again, a general decline in tobacco use. For cigars, cigarettes, smokeless tobacco like snuff or chewing tobacco, it's all going down. This decline is primarily driven by male students and Black and Hispanics, although it's happening among all races and genders. But e-vapor products are by far the most popular tobacco product. And I'll show you when we get to the tobacco section. Finally, students of all races and genders reported a significant increase. I'm so sorry, my dog just barked. In avoiding school because of safety concerns, and this increase was highest among Hispanic students. And we're gonna jump straight into it. So there's a lot of slides. The YRBS asks, I think, about 120 questions. It's a lot of graphs. So we'll probably go a little quickly, and we're going to skip some of the trends that I mentioned in the summary slides. But you guys can contact the team with any questions that you have. Some of these reports and slides are also going to be on the website, like Jania talked about. So hopefully the speed does not discourage you from looking into all of this information more deeply. This question asks students if they have had sexual intercourse during the past 3 months. This is the definition of whether you're currently sexually active. This trend line is going down. This trend was not a significant decline prior to 2021, but it is now. And you can see what I'm talking about with the confidence interval. This dark blue line are the actual survey results from the kids that were included and asked this question. The confidence interval around it in the light blue is where the general area of where we think the real answer for all Howard County students lies. So in 2021, 11.6% of survey respondents said they were sexually active. It could be a little higher than that. It could be a little lower than that because of the confidence interval. When we break this question down, this sexually active question down by gender, we see that it is mostly driven by males. So males are in green, females are in orange. They're faded out a bit because their decline in sexual activity is not significant. For males, this downward trend was significant in 2018. It was significant prior to the pandemic. It continued in 2021. And we can see how where male students started in 2013 and where they've basically ended up in 2021, that decline is very rare, real, and significant. Unfortunately, though, we do see an increase from 2018 to 2021 in students who are not using birth control during their last sexual intercourse. This significant increase is completely driven by the difference between 2018 to 2021, which suggests correlation is not causation, but it's suggestive that something that happened between 2018 and 2021 is the main reason for this. This is also, I think, a good indicator of how confidence intervals can change, because this question was only asked of students who were sexually active. So this is a much smaller population to draw from. which means that the smaller the population, the less sure we can be about where the actual real answer is. Speaking of confidence intervals, this question asks, were you hurt on purpose by someone you had been dating in the past 12 months? This question is, once again, only asked of students who said they had been dating someone in the past 12 months. So this is a fairly small pool. When we look only at the males in that pool, this is about 200 students. So the confidence interval gets pretty wide, since that sample population is just not that big for this particular question. But even so, we see that these confidence intervals don't overlap, which indicates that there is a real increase. It is statistically significant that male students are experiencing a rise in dating violence, even if we don't know exactly how big an increase because of the wideness of the confidence interval. Since this is a very serious topic, I took a look at the data for female students as well. And this is a good example of how statistical significance is a very high bar and it just can't tell you everything. So between 2018 to 2021, there's a visually apparent increase in the number of female students who were reporting the same thing, that they had been physically hurt on purpose by someone they had been dating. But this is not statistically significant. The confidence intervals overlap. We just can't be sure. Maybe the real numbers don't show this kind of increase among female students. But we know that this trend among males is happening, and so it could lead us to question, is it going to happen to female students as well? Are male students a leading indicator, or is this kind of isolated to one gender? Moving on to mental health, once again, these are some of the clearest and most concerning trends in the entire YRBS. This question asked students, did you feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities during the past 12 months? Because that's a handful, I'm just going to call this depression. You can clearly see the line is going up. This upward trend was significant prior to 2021, prior to the pandemic. It only kept going. It is a significant increase for both genders, but for one gender more than the other. So looking at females, they report significantly higher reporting of depression than males. The upward trajectory is sharper than among males, and this is kind of a topic, a trend we'll return to as we talk about mental health in Howard County high schoolers. Looking at depression broken down by race, the increase is significant for all races. Hispanics are in orange, Black students are in blue, whites are in red, and those lines are going up for all three races. This question asks, have you seriously considered attempting suicide during the past 12 months? Again, there's that upward trajectory. This trend was actually not significant prior to 2021, but like I said, significance is a fairly high bar. We can kind of see that there is an apparent upward line. It just wasn't quite significant until 2021. This trend in seriously considering suicide, it is only significant for female high schoolers. It was not significant for males, and once again, there's a quite significant difference between the two genders on this topic. When we look at it by race, we see that Black and white students have reported a significant increase in suicide contemplation. But when we look at the data for Hispanic students as well, that's mostly because Hispanic students have reported consistently high suicidality throughout the years. and now Black and white students have now just kind of caught up to where they have been. And this is a new type of graph. I hope you're not tired of them. This is the same question, seriously considered attempting suicide, split up by race and gender. And once again, we see that gender divide. We see that the increase is significant for Black female students and white female students, but once again, that's because Hispanic female students have reported consistently high suicide contemplation. And for male students in the greens and the blues, it's just not a significant increase for male students of any race. This is yet another question on suicide. This one asks if you've made a plan for how you would attempt suicide during the past 12 months. So this is an escalation of the previous question, a sort of look into how serious this contemplation of suicide was. This trend is going up. It was actually significant prior to 2021, and you can see it actually plateaued a bit between 2018 to 2021. Nevertheless, the overall trend is upward. Once again, this upward trend is only significant for female high schoolers. And looking at it by race and gender, this increase is only significant for, in particular, Black female high schoolers. But what's interesting is that given the gender divide, and in some cases the racial divide on suicide contemplation and depression, male and female students actually report attempting suicide at very similar rates. So you can see, once again, males are in green, females are in orange. You can say that female students, their rate was a bit higher, but you can see that their confidence intervals overlap. You really can't say that one is significantly more than the other. They have very similar rates, which indicates somewhat that there's maybe a difference between how the genders process depression and thoughts of suicidality. This is the same question. Did you attempt suicide in the past 12 months? Divided by race. Once again, they all overlap. This seems to be a problem for all races. Black students do report the highest rate, followed by Hispanics and then by whites. And then broken down by race and gender, leading, that sounds wrong, I apologize. The demographic reporting the highest rate of attempting suicide in the past 12 months are Black females. This is kind of consistent in what we see in the last few slides, right? That Black females do seem to be experiencing the higher rates of poor mental health, suicidality. But once again, I think that's an important takeaway. We really can't say that there's a particular racial group or demographic that's doing, great. They all do overlap each other. Okay, well, we're gonna move on to alcohol. This is a little less grim. This question asks students if they have had at least one drink of alcohol in the past 30 days. This downward trend is significant. It was significant in 2018 prior to the pandemic and continued to be significant. It was significant among both male and female high schoolers and among all races. But I would like to call attention to Black high schoolers who have consistently had the lowest rates of alcohol consumption. they do appear to be declining more sharply than white or Hispanic high schoolers as well. This metric, however, is a little more concerning. So in the interest of time, I'm skipping a lot of the other alcohol trends like binge drinking and whatnot. Rest assured, they look very similar to these graphs. This question asks whether you have ridden in a car driven by someone who had been drinking alcohol in the past 30 days. This is technically a downward trend, but visually you can look at it and notice that it's been declining until 2016 and then sort of plateaued. And when we break it down by gender, we actually see why. This decline in riding in a car driven by a drunk driver is only significant for male high schoolers. For male high schoolers, you can see that that decline maintained itself. It kept declining. But for female students, you can see that female students, this trend was a significant decline in 2016 from 2013. But since then, it's actually reversed and appears to be heading upwards non-significantly, but once again, not a great visual, potentially a concerning trend. This is a similar question, except it asks if you have driven the car when you had been drinking alcohol in the past 30 days. Once again, this decline is only significant for male high schoolers. It keeps going downwards. For female high schoolers, we can see a sort of worrying U-shaped graph. Again, this increase from 2016, 2018 is not significant, but it does kind of tie in with the previous question. Together, we can look at the big picture and maybe draw some conclusions. Tobacco, these are fairly straightforward metrics. So this question asked if you've used or tried tobacco products for the first time during the past 12 months. This downward slope is extremely clear, extremely straightforward. This trend was significant prior to the pandemic happening. This decline was significant among both male and female high schoolers and among all genders. And a lot of the tobacco metrics look fairly similar to this. This question asks whether you live with someone who now smokes cigarettes or cigars. And I thought it was interesting to note the decline here, because this is not really something that's in control of your average high schooler, but it's a downward trend. It was significant prior to the pandemic and continued downward. Now, this question lumps a few categories of tobacco use together. It asks if you have used cigarettes, cigars, or smokeless tobacco, which includes, the question defines it for them. It includes chewing tobacco, snuff, things high schoolers are really into, in the past 30 days. And you can see this downward trend is significant. It was significant prior to the pandemic and continued. Compare that to the next question that asks the same question except for all tobacco products, including e-vapor. So that this is not really a graph that's consistently going up or down. Technically, yes, the survey response rate in 2021 is significantly lower than the one in 2014. But looking at the pattern of this data, it seems more likely that this number simply oscillates from year to year, which is because it very closely follows the usage rate of e-vapor products. You can see how similar these two graphs are, and how e-vapor products really do dominate tobacco use among high schoolers that use tobacco. All right, that's enough of that. And we'll talk about a little bit of violence, but it's a little ambiguous here for this question, because this question asks students if they did not go to school in the past 30 days because they felt they would be unsafe at school or on their way to or from school. Now, this question was drafted in 2013, and they've just been asking the same question with the same wording ever since. So there's no way to really clarify, is your safety concern physical, or is your safety concern, for example, catching COVID and bringing it home to your grandparents? But I'm so sorry. I have left off the year markers on this graph. But 4.6 is 2018 and 10.4 is 2021. And we can see a significant upward jump between those years. In fact, this is the only significant change in this question, is that jump from 2018 to 2021. This increase is significant among male and female high schoolers. And we do see this increase among all races, but Hispanic high schoolers are interesting in this aspect because unlike Black and white high schoolers, Hispanic high schoolers started reporting this increase back in 2018, which suggests that they might not be following the same pattern for this as Black and white high schoolers. I'm not sure what could be causing that. It could be a data irregularity. Other violence metrics include bullying on school property. This has been a significant decline over the years. And being on a fight on school property in the past 12 months, this is a significant decline among Hispanic high schoolers. Okay, so this, I think, was a pretty good segue into directly addressing what the possible pandemic effects on the survey might have been. So we can also look directly at what's changed significantly between 2018 and 2021. So we just talked about how between 2018 and 2021, students felt less safe going to school. There's also been a significant upward change in depression, in students identifying as transgender, in soda drinking, a significant downward trend in change in eating breakfast, tobacco use, gambling, participation in extracurricular activities, for Black students, food insecurity, and as we also talked about, practicing safe sex. So I'm just trying to show you the other things that we can do with this data, the other ways that we can present it. This is just kind of what a graph of all of that would look like. And this way you can see visually by topic, what trends began and were really significant before the pandemic, and what trends happened maybe dramatically or because of the pandemic. And we can see that, for example, with mental health, depression, this first question, it's just been an increase all around. There was a significant change from 2018 to 2021. There was also a significant change from 2013 to 2018. It's just going up no matter what. But we can also see that in terms of nutrition or physical activity, a lot of these trends began in 2018 or became significant in 2018. And the main change that we see during the pandemic is changing habits in eating breakfast. kind of the same story with tobacco. We can see a lot of the trends started becoming significant in 2018. Drug use and alcohol, very similar stories there. And these adverse childhood experience questions or questions about a lot of them were not asked in 2013 and were only started being asked in 2014, 2016, or 2018. So this data is a little more iffy, but we can also look at that as well. Finally, we can look at the differences between various demographic groups. You remember how the survey collected information by race and gender, so we can look at that for a certain year and say, in 2021, males were significantly more likely than females to eat breakfast and gamble, but less likely to feel depressed or eat salad. And that's just kind of what that comparison graph would look like. We can also do it by race. We can say that Black students, compared to the Howard County average in 2021, they're more likely to drink soda and test positive for COVID, less likely to eat vegetables or binge drink. And also do the same for Hispanic students who, compared to the Howard County average in 2021, they're significantly more likely to feel depressed, take prescription drugs without a prescription, be sexually active, have a concussion from playing a sport, experience food insecurity, but also be less likely to eat breakfast, participate in extracurriculars, and feel that they're able to talk to an adult about their feelings. And that's what that chart would look like when we look at it by race and compare it to the Howard County average.